Welcome to the deep dive. Today, we're looking into something pretty heavy, something that really shapes a lot of lives, the lasting impact of trauma.
It really does. And just to give a sense of scale, maybe start with some numbers. The CDC data is, well, it's sobering.
Yeah, it really is. Think about this. Roughly 1 in 5 Americans experienced sexual molestation as a child.
1 in 5, that's huge.
And nearly 1 in 4 were beaten by a parent severely enough to leave a mark.
Mm-hmm. And violence isn't just in childhood. 1 in 3 couples, physical violence.
It's staggering. Then add in, 1 in 4 growing up with alcoholic relatives?
Right, and 1 in 8 seeing their mother beaten.
So it's pervasive. But humans are resilient, right? We bounce back from incredible hardship, wars, disasters, loss.
We absolutely do. But, and this is key, these experiences don't just vanish. They leave traces. Deep ones.
Traces where? Like in our stories?
In our stories, yes. Histories, cultures, families, those dark secrets passed down. But also inside us.
Inside? You mean like mentally? Emotionally?
Exactly. On our minds, our emotions, our capacity for joy, for intimacy, and even on our biology, our immune systems.
Wow. Okay, so this deep dive, we're using some really insightful material to go beyond just like the definition of trauma.
Right. The goal isn't just what it is, but understanding its complex, lasting effects, what it means for you, for how we live.
Let's start with an example. Tom's story. It really shows how trauma can disconnect someone even when they look totally fine on the outside.
Yeah, Tom. He was valedictorian, class of 65. Smart kid.
Followed his dad into the military. Dad was WWII.
That's right, family tradition. So Tom joined the Marines, did basic training, felt really strong, capable.
And then Vietnam. As a platoon leader, must have seen some terrible things.
Unimaginable things, yes.
Ah.
But afterwards, he seemed to do great.
Right. College on the GI Bill, then law school, got married, high school sweetheart.
Yep. Had 2 sons, built a thriving law practice, looked like the picture of success.
But inside, that's where the story changes.
Completely. He couldn't feel affection for his wife, even though her letters were like his lifeline in Vietnam.
That's tough. He felt dead inside. Is that the phrase?
Dead inside, yeah. And just not normal. Like he was fundamentally different, even with all the success.
It's a powerful reminder, isn't it?
Yeah.
Success on the outside doesn't mean peace on the inside. Trauma can just quietly eat away at connection.
Absolutely. And that emotional numbness was central for him.
He wanted to love his family, but just couldn't summon the feeling.
Exactly. He felt totally isolated, like behind a glass wall, frozen out.
And it wasn't just about other people, it was about himself, too.
He couldn't feel much of anything for himself either, except these sudden bursts of rage, intense anger, then just crippling shame afterwards.
That sounds exhausting.
And confusing.
And it messed with his identity, looking in the mirror, feeling like he was seeing a stranger.
Wow. Even in his job as a lawyer.
Yeah, he'd be arguing a case, doing it well, but feeling like he was watching himself from afar. Detached. So professional competence, but no sense of purpose. Just going through the motions.
Pretty much. That inner fragmentation Tom felt, it's really stark.
Let's look at other ways this stuff shows up. There's Bill, another vet. The Rorschach test.
Ah, yes.
Yeah.
Bill's reaction. 1 ink blot.
Yeah.
Bam! He saw it as a child killed in Vietnam.
And he described it, like, vividly.
Oh, yeah. Charred flesh, wounds, spurting blood. He was right back there.
10 years later, just from an ink blot.
10 years later, in an office, panting, sweating, the whole panic response triggered instantly.
That just shows how trauma gets locked in, doesn't it? In the senses, the body, ready to fire off.
Exactly. It's not just combat vets either. Think about psychiatric wards.
Midnight confessions.
Right. Patients opening up about childhood abuse, neglect, rape, seeing violence at home. Terrible stuff.
And the statistic is, over half of people seeking psychiatric help have histories like that?
Over half. It's huge. Yeah. But then you look at the morning rounds.
And the discussion is different.
Very different. Often focused just on managing symptoms, suicidal thoughts, self-harm. Necessary, of course, but
not getting to the root causes, the despair.
Often not. Kind of dispassionate sometimes. Less focus on their strengths, hopes, relationships, what brings them peace. Just managing the crisis.
Feels like a missed opportunity, maybe, for deeper healing.
It can feel that way. And it's interesting, even way back, Bleuler in 1911 noticed something.
Bleuler, with schizophrenia patients.
Yeah, he saw they often had vivid sexual hallucinations.
Yeah.
and he connected them to actual experiences of abuse they'd had.
So even then, there was an inkling that trauma could manifest in really complex ways, like imperception itself.
Exactly, the body's memory showing up in these really distressing ways.
Then there's Sylvia's story, abused by her brother and uncle.
Yes, and her big realization was that even well-meaning help from staff could feel, well, like it was happening again. Re-traumatized
It's
it.
because of the power imbalance, the lack of control.
Precisely, which led to a really important rule or guideline.
What was that?
Basically,
Yeah.
don't do something to a patient that you wouldn't do to your own friends or kids. If there's any risk, it echoes their past trauma.
That makes so much sense. Requires real sensitivity.
Absolutely. And it wasn't just the emotional stuff. They noticed physical things too.
Like what?
Like, patients often seemed clumsy, uncoordinated. Even their conversations felt stilted, lacking natural gestures, expressions.
So the trauma is literally in the body, affecting how they move, how they interact nonverbally.
Seems like it. It sort of foreshadows later ideas about body-based therapy, how the body holds the score, you could say.
Okay, let's shift to this idea of repeating patterns. Freud's compulsion to repeat. He thought it was about gaining control, right?
He has his initial idea, yeah.
Yeah.
An unconscious attempt to master the trauma by replaying it, maybe changing the outcome.
But the source material here takes a different view.
It does. It suggests that often the repetition doesn't lead to mastery at all. It just leads to more pain. Reinforces feeling helpless or bad.
So even talking about it repeatedly in therapy, if not done carefully.
That could actually make things worse. Cement the fixation rather than resolve it. Yes, that's the caution here.
Which leads to the question, why are people sometimes drawn back to dangerous or painful situations? What are attractors?
Attractors are things that pull us in, make us feel alive.
Yeah.
And for someone traumatized, sometimes what feels familiar, even if it's negative or dangerous, can be a powerful attractor.
That's counterintuitive.
It is. Richard Salman's theory helps a bit here, the opponent process theory.
Okay, how does that work?
Basically, the body tries to balance things out. A strong stimulus, good or bad, triggers an opposing reaction.
Like a rebound effect?
Kind of. So if you're repeatedly exposed to something negative, the initial bad feeling might decrease over time, but the opposing reaction may be relief or just feeling something intensely gets stronger.
Like intense exercise. Hurts at first, then feels good.
Exactly. The body adapts, releases endorphins, it becomes rewarding. But it's different from the immediate hit of a drug. It's the body adjusting its own chemistry.
So the body might learn to seek intense states, even unpleasant ones, to get that rebound feeling, a kind of internal regulation attempt.
That's the idea. Fascinating, complex stuff. Now let's dive into the brain science.
Okay. Brain scans. They recreated trauma moments using bits and pieces, images, sounds.
Yeah, isolated fragments. And compared brain activity during those moments to activity during safe, neutral scenes.
And what did they find? Let's take Marcia's case.
Marcia, 13 years after her trauma, just lying quietly in an fMRI scanner, listening to a script about it.
And her body reacted.
Big time. Heart rate up, blood pressure up, breathing faster. The whole fear response kicked in automatically, even in that safe setting.
Wow, 13 years. It just shows the imprint is still there physiologically.
Absolutely. And maybe the most striking finding was what they call speechless horror.
Speechless horror, what's that?
They saw decreased activity in Broca's area during flashback.
Broca's area, that's language, right, in the left frontal lobe.
Exactly. The part of the brain you need to put thoughts and feelings into words. During a flashback, it could actually shut down or become less active.
So the feeling of not being able to speak, of being literally speechless with terror, it's actually happening in the brain.
That's what the scans suggest. It's like the trauma's effect overlaps with a physical injury, like a stroke, impairing language.
That makes so much sense for why people struggle to talk about it.
It really does. And then there's the whole stress hormone system. Adrenaline, cortisol.
Preparing for fight or flight, normal response.
Yes. But in traumatized individuals, it's often dysregulated.
How so?
The hormones take longer to return to baseline after stress. They spike higher and faster, sometimes even to minor triggers.
And that chronic stress state has consequences.
Major ones. Memory problems, irritability, sleep issues, long-term health problems, heart disease, autoimmune issues, you name it. The body wears down.
Okay, so we have the emotional brain, reptilian brain, limbic system always scanning for danger.
Right, our survival system, giving us those gut feelings, those visceral sensations that guide us.
But when trauma disrupts that system, you get things like depersonalization.
Yes, seeing people tell these horrific stories, almost like they're talking about someone else. No feeling
And
attachment.
watching yourself from the outside.
Exactly. And when someone's in that blanked out state, conventional talk therapy struggles.
Why?
Because if large parts of the brain are tuned out, they can't really think clearly, feel deeply, access memories properly, or integrate the experience. You need engagement for talk therapy to work.
So it boils down to what? Most mental suffering involves problems with relationships or regulating ourselves.
Pretty much. Difficulties connecting with others or managing our own internal state arousal, emotions, often both.
And the focus on just medicating symptoms.
Can sometimes miss the bigger picture. Our fundamental need for connection, our functioning as social beings. Yes, that's a concern raised.
Which brings us right to connection and attachment. Feeling attuned with others via the ventral vagal complex, the VVC, that's inherently rewarding.
Absolutely. It's our social engagement system.
Yeah.
It lets us feel safe, connect, play, sync up with others. It feels good. It feels right.
So trauma then is when that system fails, gets overwhelmed.
Essentially, yes. Overwhelming threat leads to immobilization, and the more primitive system, the dorsal vagal complex, or DVC, takes over.
But association, fainting.
Exactly. It's a survival mechanism, but it takes us out of connection.
And Porges's work. He said we need to temporarily shut down our defenses for closeness, for play, intimacy, nurturing.
Right. We can't be fully defended and fully connected simultaneously. There has to be a letting down of the guard, a sense of safety.
But traumatized people often can't do that. They're stuck on high alert or numb.
Often, yes. Hypervigilant, always scanning for threats, or numb and disconnected, unable to register safety even when it's there. The brain's smoke detector is faulty.
Leading to inappropriate responses, overreacting or underreacting to danger.
Precisely. And that ACE study finding is chilling women with abuse-neglect histories being more likely to experience adult rape. It suggests that faulty danger signaling persists.
And it's not just physical or sexual abuse. Emotional abuse, neglect, just as bad.
Absolutely devastating. Sherry's story makes that painfully clear.
Feeling unseen, unsafe her whole life.
Leading to this joyless existence and then that horrific kidnapping where her own mother wouldn't help. It shows the catastrophic impact of having no safe base.
That lack of safety really disrupts the sense of self, doesn't it? This mohawk of self-awareness you mentioned.
Yeah, that network, orbital prefrontal, medial prefrontal, cingulate cortex, insula, it's like our internal compass for feeling and relevance.
And in chronic trauma, activity there is lower.
Often, yes.
Yeah.
Making it hard to know what you're feeling or something matters to you. And in severe early trauma cases, scans show almost no activation in those self-sensing areas.
Wow, it's like the self isn't registering. Damasio talks about the proto-self.
Right. That foundational, wordless sense of our physical being, tied to basic body regulation. He argues that knowing our body's state moment to moment is fundamental for navigating life.
That wordless knowledge is the bedrock of our conscious self.
That's his point. Without that accurate internal feedback, it's hard to have a stable sense of self.
Let's look specifically at kids. That study comparing abused kids to others in a high-violence area.
Yeah, and even the control group it's seen a lot. Tells you something about the environment.
But the abused kids reacted differently, more aroused, disorganized when talking about things.
Definitely. Even to seemingly neutral things, like the 7-year-old girl who'd been sexually abused.
What happened?
She saw a picture of a pregnant woman and responded with sexually explicit comments, just completely out of context, triggered by the image. Shows how distorted things get.
It really highlights that hyperreactivity, and this connects back to Bowlby, Winnicott, those early thinkers.
Absolutely.
Yeah.
They were all exploring how crucial those first relationships are for shaping our inner world, our sense of self, how we connect later.
Tronick's still-face experiment, that dance of attunement, rupture, repair.
Such a powerful illustration. And Winnicott's Good Enough Mother, the need for the caregiver to really see and respond to the baby's reality.
What happens if they don't? If the mother can't tune in?
The baby might learn to ignore its own feelings, its own body, and just try to be what the mother seems to want or expect. A fundamental disconnect from the self starts right there.
But most kids develop secure attachment, right?
Thankfully, yes.
Yeah.
And that secure base gives them emotional security, helps them understand others, navigate relationships. They become good playmates, part of the community.
But insecure styles avoidant, anxious they happen too, and can last.
They can, yes, affecting adult relationships significantly. And disorganized attachment, often from frightening or inconsistent caregiving.
That's linked to more problems later, emotional, behavioral, even physiological stress.
Definitely. Mary Main's research showed 6-year-olds with disorganized attachment had really fearful responses, even just imagining separation.
Bowlby's quote comes to mind. What cannot be communicated to the mother cannot be communicated to the self.
Powerful, isn't it?
Yeah.
It links that early relationship directly to denial, dissociation, that awful feeling of not being real inside. If you can't share it, you can't integrate it.
Like Marilyn, dissociating during abuse by focusing on the wallpaper.
The survival strategy. Absolutely necessary at the time.
But then her mother's reaction, unsupportive.
Yeah. Didn't validate, didn't help. Which just compounded the isolation and the trauma.
Yeah.
Made it harder to feel real, harder to heal.
This brings us to how we categorize this stuff. The DSM-5 in 1980. Big shift.
Huge shift. It became the standard, the Bible almost, for diagnosis,
Yeah.
despite warnings about using it for insurance or legal stuff.
And it influenced everything. Insurance, research money, training, even TV shows.
Pretty much. Tony Soprano, Carrie Mathison, their diagnoses became part of the cultural conversation.
Right.
But did it always serve patients best? That's the question.
That study question is haunting. Was there anyone you felt safe with growing up? And 1 in 4 said, nobody.
1 in 4. Just think about navigating childhood utterly alone without that basic sense of safety. It's devastating.
And there was an attempt to add developmental trauma disorder to the DSM for chronic childhood trauma.
Yes, a big push. Field trials, support from mental health commissioners. But it didn't make it in.
Why not?
Complex reasons, politics within the field.
Mm-hmm.
But its exclusion leaves a gap, arguably. We lack a specific label for that complex early onset picture.
But then came the ACE study, adverse childhood experiences. That was huge, right?
Absolutely groundbreaking. Started almost by accident by Vincent Flitti at Kaiser.
In an obesity clinic, how did that happen?
He noticed patients losing lots of weight would suddenly drop out. When he asked why, many reveal histories of childhood trauma that surfaced as the weight came off, like the weight was armor.
Wow, so that led to the big study.
Yes, surveying thousands about childhood adversity, abuse, neglect, household dysfunction, and their adult health.
And the link was strong.
Incredibly strong. A clear dose-response relationship. More ACEs meant higher risk for tons of problems: heart disease, depression, addiction, violence, early death. It connected the dots between childhood and lifelong health.
So the takeaway is, social support isn't just nice, it's a biological need. It should be central to prevention and treatment.
Exactly. And it's not about blaming parents. It's about realizing families need societal support, something the U.S. lags on compared to other developed nations.
James Heckman, the economist, showed investing in early childhood programs pays off.
Big time.
Yeah.
Huge economic returns from quality early childhood education and support. Reduces costs down the line, healthcare, crime, welfare.
Like David Old's nurse home visitation program.
A fantastic example. Nurses helping new mothers create safe, stimulating environments. The long-term results for the kids were amazing.
Better health, less abuse, more education, better jobs, less crime.
All of that. And significant savings for society. It shows early intervention works, and it pays for itself many times over.
Okay, let's circle back to how trauma is stored. Charcot and hysteria. Embodied memory.
Yes, late 19th century. He saw patients with physical symptoms, like paralysis, with no physical cause, linked to trauma. Lelog's case is classic.
The guy paralyzed after a traffic accident, even though he wasn't physically hit.
Right. His memory of the anticipated impact was expressed physically, in his legs. He couldn't consciously recall the moment, but his body remembered. Somatization.
It's wild how the body holds on to things, but sometimes society doesn't want to hear about it, like the Nazis burning All Quiet on the Western Front.
A chilling example. Acknowledging the psychological devastation of war was a threat to their ideology. Shows how understanding trauma can be politically inconvenient.
So how are traumatic memories different from normal ones? Organization. Physical reaction.
2 key things, yeah. Normal memories are usually coherent stories, beginning, middle, end. Fairly neutral physically.
But traumatic memories.
Fragmented. Disorganized. You might get vivid sensory flashes, a smell, a sound, but no clear timeline or context. And the physical reaction can be intense, distressing even years later, like Marcia in the scanner.
Nancy's story about anesthesia awareness fits this. Fragmented memories. Hard to integrate.
Perfectly. It was a terrifying, traumatic experience, broken into pieces in her memory. Her healing journey was long.
What helped her?
Finding a safe hospital environment, talking openly about her history beforehand, and therapies that address both mind and body, psychodynamic therapy, and Pilates, a multi-pronged approach.
Which brings us to healing pathways. The goal is restoring balance. Rational and emotional brain working together.
Exactly. Regaining control over reactions, getting back in the driver's seat of your life, expanding that window of tolerance.
The zone where you can handle stress without getting overwhelmed, hyper-aroused, or shutting down hyper-aroused.
Precisely. Effective therapy helps widen that window.
And the therapeutic relationship itself is key. The therapist being curious, collaborative.
Crucial, especially for those betrayed by caregivers. Feeling safe with a therapist is paramount.
And even remembering one safe person from childhood can be a starting point.
A tiny seed of hope, yeah. A reminder that safety and connection are possible.
What about experiencing sensations and emotions safely? Sometimes meds get used instead.
Yeah, the source suggests mainstream approaches might sometimes bypass actually feeling things safely. But basic things like touch, hugs, rocking, they're natural ways we calm distress, feel grounded.
Body-based regulation. What about CBT exposure therapy? The source critiques it.
It raises a caution.
Yeah.
Just reliving trauma repeatedly, especially if the person can't regulate, might just reactivate the alarm system, make things worse, not better. High dropout rates for vets, for example.
You need to be stable enough to process it.
Right. Within that window of tolerance.
What about MDMA-assisted psychotherapy? How might that help?
The idea is it might temporarily lower fear and defensiveness, open up that window of tolerance, allowing access to traumatic memories with more compassion and less overwhelm. Different from old LSD claims.
So creating a safer internal space to revisit the trauma.
Potentially. Research is ongoing, but it looks promising for some.
And just truth-telling. Acknowledging the painful stuff.
Fundamental. Suppressing feelings takes energy, leads to physical symptoms, weird behaviors. Facing the truth, like Marlantes did after Vietnam, is essential, however hard.
Integrating the emotions, too.
Absolutely. Then there are body-based approaches,
Yep.
islands of safety. Yeah, finding neutral spots in the body, hands, breath to focus on when distressed. Grounding yourself in present sensation. Qigong, mindful movement helps too.
Reconnecting safely with the body. Maggie's EMDR experience sounds intense.
Very. Reliving childhood sexual abuse vividly, but while feeling her adult self present, led to huge emotional release and cognitive shifts.
How does EMDR work, basically?
The eye movements or other bilateral stimulation seem to help the brain process and integrate the stuck memory, connecting the emotional intensity with adaptive information.
The trauma clinic used it successfully. But it's not a magic bullet, especially for complex childhood trauma.
Right. Chronic childhood abuse often needs longer-term, broader approaches than single-incident adult trauma, though EMDR has surprisingly helped some combat vets too.
And that link between chronic anger, fear, and physical pain. Tension, misdiagnosed conditions.
Crucial connection. Unresolved trauma often manifests physically. Need that holistic view.
Let's talk about the inner world parts, like conflicting feelings.
Yeah, the idea that we all have different aspects, different parts of ourselves with their own feelings, beliefs. Sometimes they clash. That's where internal family systems, IFS, comes in.
IFS assumes there's a core self, mindful, compassionate.
Exactly. A core self that can understand and help reorganize the inner system, help the different parts trust that someone capable is in charge inside. Neuroscience even shows mindfulness boosts activity in self-awareness areas and calms the fear center.
Joan's story illustrates this, learning to have compassion for her powerless part holding abuse memories.
Beautiful example. Shifting from fighting or hating a part to understanding its role in pain.
And Brian, uncovering his parts, panicked, protector, caretaker, exiled child, shows the complexity trauma creates internally.
Absolutely. These parts develop as coping mechanisms. Therapy helps understand them. Heal the wounded, exiled parts carrying the core pain.
What about action, psychomotor therapy, rewriting scenes?
Yeah, physically feeling the past, visualizing, saying what couldn't be said, using role play and movement to enact different outcomes.
Like creating tableaus, acting out ideal responses, a protective parent maybe.
Exactly. It can stimulate powerful emotions and create corrective experiences. Feeling protected, seen, supported, even if it's enacted. It can unburden old guilt and helplessness, creates virtual memories of safety.
Replacing panic with mastery, connection.
That's the goal. Maria, directing someone to be her terrifying father, shows how precisely the body remembers and projects these roles. Amazing precision, often. The right hemisphere holds those implicit, embodied memories. Psychomotor taps into that directly.
Okay, briefly, neurofeedback, training brainwaves.
Yeah, based on EEG readings, used for epilepsy, ADHD. McFarlane found dysfunctional patterns in PTSD too.
So neurofeedback tries to change those patterns. Sieber and Fisher used it with severely disturbed teens.
Yes, with promising results, especially when talk therapy wasn't possible, like with Lisa, who had severe early trauma. It helped her regulate in a way nothing else had.
Targeting specific brain waves, like beta for focus versus anxiety.
Right. Learning to self-regulate brain activity. It can improve focus, calm, even creativity. But funding and insurance coverage are still limited.
Finally, embodiment and community. Theater.
Huge potential. Embodying emotions, giving voice, rhythmic engagement with others, things traumatized people often fear or struggle with.
Confronting tough human experiences together. Resonating with survivors' realities.
Exactly. Betrayal, assault, loss theater tackles these collectively. It's whole body engagement, feeling connected to others.
Mirroring exercises, like in trauma drama, helping kids tune into each other.
Great example. Fostering that visceral attunement, rebuilding safety and connection non-verbally.
And the girl playing Ophelia, who usually ran away, but stayed for the play.
Powerful story. The commitment to the group, the value of the creative process, overrode the escape impulse. Shows the power of belonging and purpose.
So where does this leave us? Neuroscience is advancing our understanding.
Tremendously. How trauma changes the brain, self-regulation, connection. It gives us better tools, better targets for intervention.
And models for collective healing, like South Africa's Truth and Reconciliation, the Ubuntu principle.
Recognizing our shared humanity, our interconnectedness, is vital for healing collective wounds.
Because humans are social, trauma hits that social engagement system hard.
Devastatingly. Which is why focusing only on faulty thinking or suppressing feelings misses the mark. We need to address emotional engagement, connection.
And punishing kids in school for trauma behaviors just makes it worse.
Re-traumatizing, often. Trauma-sensitive schools are crucial, acknowledging upset, calming, exploring causes, being consistent and predictable.
Creating safety.
The foundation. And acknowledging all the pioneers, Levine, Ogden, Kolk, so many others who've paved the way.
Plus the ongoing effort to define things better, like those proposed criteria for developmental trauma disorder in the appendix. Affect, attention, behavior, self, relationships, all impacted.
Shows the pervasive nature of early complex trauma. We need that comprehensive lens.
So wrapping this up, it's incredibly clear trauma's impact is profound. Neurobiology, relationships, our sense of self.
It touches everything.
Yeah.
And really understanding these effects, well, that's the vital first step towards healing, towards resilience, for ourselves and others.
Absolutely. It's an ongoing journey understanding this. And we really hope for you listening that you'll consider how this information resonates in your own life, your own interactions.
Which leads us for the final thought, maybe something to chew on. Given how widespread trauma is and how deep its consequences run, how do we as individuals, as communities, as a society, consciously create more spaces of safety, of real attunement, of genuine support? How do we really interrupt that cycle of suffering and foster true lasting healing?